welcome to Career Spotlight with Vanessa Ajamai. Today I've got another amazing guest who is coming to share their career journey story. Make sure that you subscribe and that you turn the notification on in order to hear more career journey stories about choices and decisions that people have made to get to where they're currently at or where they're going. So today, the guest that I have is Doctor Desmond Owusu, who is a husband, a father, and a radiologist consultant. So I have known Desmond since I was a child. I met him at church, and so it's been a really long time. I reached out to Desmond and asked whether he could come and share his story so far in terms of his journey to becoming a doctor, and he agreed. I can't wait for you guys to hear his story. Hey Desmond.
Hey.
Thank you so much for taking time aside and out of your busy schedule to come, and also sticking to your word when you said that you'll make yourself available.
No problem, my pleasure to come on.
Thank you. Okay, so we'll get straight into it. Tell us a bit about what you do right now.
Yeah, so as you mentioned, I'm a clinical radiologist.
Yeah.
So that's one of the subspecialties within medicine. So I currently work in a hospital. I work in Darren Valley Hospital, which is in Dartford. My job entails me looking at scans. So essentially, if you've ever had an X-ray, a CT scan, an MRI, or if you've ever had an ultrasound, it's my job to essentially perform and report those scans and try and make diagnosis using that technology, basically. Yeah.
Nice. What does a day in the life of your role do?
Yes, I think it varies from day to day. So I can give you a typical week,
Okay.
just because it's quite broad. So for example, on a Monday, I go within radiology. There's even subspecialties within radiology. Mine is something called nuclear medicine, and also oncology, so kind of cancer imaging. So on a Monday morning, I might go in and do some reporting. So there'll be scans that have been done over the weekend, for example, and I'll put a report on those. In the afternoon, I might go and do some ultrasound. So in a room, patients come in, and there'll be a request from a GP, from another doctor, and I'll perform the ultrasound. Then I have meetings, things that we call MDTs. So if there are specialist cases that require discussion, so myself and radiologist, there'll be like a surgeon there, a cancer doctor, and we discuss patients to then come up with a management plan. Then I've got some managerial roles as well. I do something called governance, so that's like dealing with complaints. If there's been any errors, kind of trying to find a way in which we can learn and improve our service. So yeah, it's a combination of clinical reporting as well as talking to other specialties.
Nice, thank you. We'll come back to your role.
Yeah.
Let's take it back. What exactly inspired you to become a doctor?
Yeah, I mean, I reflect on this quite a lot because I think at the time when, I think I can probably speak for most doctors, when we make the decision of going into medicine, we don't know what it's actually going to entail. And I think at the time I was motivated mainly because I was good at science and I was good at maths, and you're looking for a career to kind of utilize that interest in, and medicine essentially stood out. So that's how I ended up in medicine. And at the time I also enjoyed, I liked working with people. I wanted to make a difference. When you're younger, you want to kind of make a difference, and I felt medicine would allow me to do that.
Cool. And how did that contribute to the subjects that you picked early on?
Yeah, so I think as a result of the kind of the affinity I had towards certain subjects, I think for most people you tend to pick what you're good at. So because it wasn't a case of I wanted to do medicine, so I picked my subjects.
Okay.
It was more I was good at my subjects, so I chose medicine, if that makes sense.
Okay.
But I also felt that I had some of the other personality traits that would be required to kind of follow that career path. So yeah, so after GCSE, we all have to do chemistry, maths. I think back in my day, you had to pick to do triple science or double science. I did triple science because I like science. And then when I went to A levels, it was a case of picking the subjects that would allow you to apply for medicine. So at that time it was chemistry, I did biology, I did maths, I did physics. And then, I stopped physics after AS. I don't know if they do that now. I think now they do all the exams at the end, don't they?
Yeah.
So I ended up doing chemistry, maths, and biology, and that's what you required. Sometimes you definitely needed chemistry. You didn't need biology. I think it depends on which medical school you're applying for. Yeah.
At which point did you know that you wanted to pursue a career within medicine, and did you explore other career avenues?
Yeah, I mean, I think as I mentioned, I had a kind of natural affinity, I'd say, towards science and maths. So I considered kind of everything around that. Dentistry, pharmacy, medicine was up there. But my actual passion, what I was really, really, really interested in at that time, was sports, football. Trying to kind of go down that route, but that didn't work out. So I mean, I think at the point where I knew I was really probably going to focus on medicine 100% was probably during A-levels. Because I think at that point I realized that I could get the grades, because that was one of the things that I was a little bit anxious about. I thought, would I be able to get the full, the full entry requirements. So when I realized that I could get that, that's when I was, dead set on it. And then I started, I did the work experience that you have to do, which allowed me to meet doctors, allowed me to meet medical students, to try and understand exactly what medical school would entail. So yeah, I'd probably say during college. Yeah.
Okay. What research did you do before deciding to take that next step?
Yeah, so I spoke to a few, luckily I had a few family friends who were like nurses, who were able to put me in touch with doctors. I managed to get work experience at a local pharmacy, and that local pharmacist had some network opportunities, so I was able to talk to people who were within who were doing medicine as well, just to kind of gain insight to what happens when you go to med school, what's life like being a doctor, etc. And then that kind of basically sealed it for me. Yeah.
Someone said that chemistry is the hardest science.
Yeah.
Do you agree?
I scraped that. I scraped that by 2 marks for A-levels. Yeah. I mean, I liked the math really good at. Biology I thought was fine, but yeah, chemistry was it was challenging. But I mean, I think I'm one of those people. I believe that if you kind of apply yourself to anything, you can do it. And when I look back at especially like I said, look, with medicine, even nowadays you still need to get the grades. And I think for me it was just when I mentioned to you, I wasn't sure I was going to get the grades.
Yeah.
It was about chemistry. Yeah, because it was chemistry. Yeah, but so for chemistry, I reckon I had to study twice as hard for chemistry as the other subjects. So I think even if you do want to do something and you feel like you're going to be limited by the grades, I think there's nothing wrong with kind of working extra hard in one thing to kind of to allow you to follow your passion. So, yeah.
What was the application process like in terms of getting into medical school?
Yeah, so sometimes this is when they were starting the UK CAT and BMAT. These are all aptitude tests. They were kind of trialing it out where they weren't using it as much. Now it's you have to do it and you have to get a certain score. If you get a certain score, then you'll get an interview. So for us, it was probably a little bit simpler. They used your GCSEs, your predicted grades, your work experience, your personal statement to decide whether to give you an interview. So you applied for those days. You applied for UCAS. I think you're allowed to apply for 6 universities. You can only apply for 4 medical schools, and then you submit everything in, and then depending on whether you've got the predicted grades, then you would get an interview. Yeah. So I was fortunate enough to actually get only one interview for medicine.
Really?
Yep, only one. Kings were the only people who wanted me. But yeah, I mean, I'm really happy I ended up in Kings. Based on the friends I met. I met my wife in Kings. So thank God for that. That was a very interesting interview. We kind of had a chat with I think there were 3 people on the panel, and they were just investigating similar to what you're asking me. Why are you passionate about medicine? Why do you want to come into it? And I think now I've come out the other end. What I've seen is quite a lot of people start medicine and then leave. So after like a year or two, they decide it's not for them. And I don't know if you know this, but it costs. Yeah, I think it costs the government about £500,000 to take somebody through medical school.
Really?
To train one doctor, £500,000.
I had no clue. Why is that?
So paying for the hospital, for example. So obviously you pay your tuition fees, which my time it was 3,000. I think it's 9,000 now. So yeah. Anyway, so if you imagine the lectures that you're having being delivered by, because it's medicine, these are people who are top of their fields. The placements, each time you go on placement, you have to pay the hospital to take the students on because they're not actually working or contributing to the service. So to be trained, you actually, is a payment to the hospital to deliver that. So it's expensive. So as part of the interview process and as part of the application process, what they're actually trying to see is people who are really interested in medicine, because the worst thing that they could do is, even if you are going to get the grades, is start training you and then you decide you don't want to do it anymore because it's actually a waste of taxpayers' money. And that place, if you leave after second year, they can't put somebody in that place because of the way the recruitment works.
Yeah. Wow, that I had no clue.
So the application essentially is trying to show that you are academically capable, which I believe most people are. I think most people are academically capable, even if people don't think they are. You are, and then secondly, also, are you passionate enough about medicine that you're going to stick through it? Because obviously, it's not the easiest course that you can do.
So, how would someone kind of soul search to really determine if it's for them?
It's like I said. I think it's even when I look back now, there was no way I was mature enough to really be able to make a proper decision. When I look at I don't want to say sacrifices, but I say sacrifices and that the field requires, because you make the decision when you're 18, not considering where your life is going to be when you're 28, 38, 48. And when everyone's making a decision at 18, it's like, yeah, of course, yeah, I can do it, yes. 6, 7 years studying, yeah, I can do that, yeah. When you finish more studying, yeah, I can do that. You don't consider that at some point you may get married, you may have kids, you've got a family, and you need to kind of balance that with, there's unless maybe your dad or your mom is a doctor and you're kind of watching them day to day, you don't realize the impact it's going to have on you. Like your whole life is essentially going to have to be based around that. So I think it's quite difficult. I think it's probably the most important thing is what kind of personality you have. And I think it's about, you have to be somebody who's determined, somebody who's interested in kind of problem solving, somebody who's able to kind of deal with stressful situations. I think those things are more important. If you have those characteristics, I think as you enter it and, these challenges come, then you're going to be able to kind of, manage it accordingly. Yeah.
Sure. In our African household, there's kind of like 3 main jobs which parents a lot of times, stereotypically anyway, push for, which is doctor, accountant or lawyer. Is it enough for your parents to be the sole motivator for why
I think
you pursue it?
Yeah, I think that my parents definitely encouraged me to kind of, because I think they saw that I was good enough to maybe have the academic potential, I guess, to pursue a career there. Is it enough alone? I don't think it's enough alone because of how challenging it is. I mean, to be fair, everybody is different. Let me put it that way. Some people find exams easy and they'll go to med school and they find it easy. They don't find it challenging. They find it fun. I'm not one of those people. I feel like I worked hard. I feel like I had to work really hard to get the grades when I was in A-level. I feel like when I was in med school, as much as I tried to have a balanced life, I feel like I worked hard. I studied a lot. And when you're doing that, your parents are, the fact that they were whispering to me, yeah, go and do medicine, is not enough to get you through. Because ultimately, it does fall on you. You're going to have to be a self-motivated person, etc. So, yes, I think it's not, you can't pursue a career like medicine because of your parents. And another main reason is the time that you sacrifice. I went to uni when I was 18. I came out when I was 25. That's 7 years. You can't sacrifice 7 years of your life to kind of please somebody. It has to be kind of something that you yourself want to do. And then even, I say 7 years, but I finished med school. I had to move outside London away from my family. I went to live in Bedford, because when you finish training, they can kind of place you anywhere in the country to kind of do your placements. So yeah, I mean, the sacrifices are essentially going to be on you. So it's not advisable for you. I don't think it will be enough. You won't be able to stay, it will not be enough to motivate you to get through. Because I mentioned to you that people do start med school and finish. Some people start med school, finish medicine and never practice.
I've heard about that.
Yeah, I've got a friend who, and that's kind of what tends to happen if you go into medicine for reasons that are not kind of intrinsic to yourself. Yeah.
Can you explain a bit more about what the process of that 7 years looks like?
Yeah. So you go to med school and then you've got the standard curriculum that you need to go through: anatomy, physiology. There's a bit of chemistry, especially in the first year. And then you have to so essentially you're learning about the whole body. So the first 2 years, 2/3 years, are probably the most challenging. It's a lot of information. It's literally top to bottom. I mean, at one point in time, I can't, if I had to learn this stuff right now, I don't think I could do it. Honestly speaking, yeah, because at one point in time, the information overload was crazy. So you spend first year, maybe, if I remember correctly, what subjects did we do first year? We did physiology, then we went through biochemistry. Oh yeah, then we have to do dissection, live dissection. So these are dead bodies that they used to get from. We've got one of the dissection labs in London in King's. So that's how we learn anatomy. Like literally, cut up the heart. Yep, this is how the ventricle looks like. Blah blah blah. Cut up the legs. Yep, this muscle is here. This muscle is there. So it was really, interesting. But like I said, it's not for the faint-hearted. For some people, you may be interested in the theory, but then when it comes to something like that, you might actually feel, you just might not be able to handle it.
Yeah.
So, that's at the point in time where you might, you will really realize whether medicine's for you. But those are the sort of things that you need to look for before you go into medicine. What does the actual course kind of entail, and whether you're going to kind of be able to hack it. So once you've kind of done all this theory, which is physiology and, biochemistry and anatomy, basically the book stuff, the stuff that you can Google and work, then you have to get through the exams, which are
serious.
I'm having PTSD, remembering, like literally all-nighters, drinking like energy drinks and not sleeping for weeks at a time just to get through the exam. Anyway, so getting through that somehow, and then you go on to like the clinical years, which are probably a bit better. So this is when they then send you to the hospitals. So then you have rotations. So you have in King's, you have.
Is that year 2?
No, that's like year 3, year 4.
Year 4, okay.
In between that, by the way, I did another degree in physiology. Yeah, I don't know why I did it, but at the time everybody was doing it.
Okay.
So they call it an intercalated BSc. Not every single med school does it. I know in UCL it's compulsory. I think it's compulsory in Imperial. In King's it's not. So some people do it, some people don't. And the reason why we did it was because the thing that people don't realize is even when you finish med school, it's not guaranteed that you can become like a surgeon or guaranteed that you can go and become a radiologist or an anaesthetist. There's a competitive application after that. So
there's not a job waiting for you.
No job waiting for you. So you finish med school, you're going to do F1 and F2. Everybody has to do that, right? That's like foundation, be a junior doctor. Then when you finish that, you then have to pick, okay, what do I want to do? Do I want to be a surgeon? Do I want to be a GP? Do I want to be a radiologist? Do I want to be an anaesthetist? And there are certain number of training places per year. So in radiology, when I applied, there's 150 positions to train as a radiologist nationally.
Nationally.
Nationally, the whole country, including Scotland and Northern Ireland. So not everybody who applies for it will get it. Things like the intercalated BSc gives you extra points.
Okay.
If you
so it
like,
gives you a competitive
exactly.
advantage.
If you've managed to like write papers and get published in journals, that gives you extra points. You know, stuff like that. So that's basically why I did the intercalated BSc, because you almost felt as if half or more than half of other medical students are going to have this extra degree that I don't have. So, you know, I basically did it. Yeah. So, yeah. So I did that in between pre-clinical and clinical. Then went into clinical years, which was rotating through like cardiology, gas, GI. So and then I did psychiatry at the Maudsley in King's, respiratory medicine, pediatrics, kind of all the stuff that we had learned theoretically. We then rotated through. Yeah, and then at that stage too, the exams change.
Okay.
Yeah, you have written exams, but most of your exams is clinical. So they'll kind of observe you, kind of examining the patient, making a diagnosis. Yeah, so then the style of the examination also changes in the latter years as well. Yeah.
So it's very intense and not for the faint-hearted.
But to be fair, we have. I don't wanna come across as if it was all doom and gloom.
Yeah.
Now we had fun, man. We had fun. I played on a football team. You make your friends for life in med school. I'm still in touch with most of them now. It was probably amongst the best times in my life, in all honesty. Despite it's just pressure. I think at the time you feel pressure. When we first go into med school, you're happy, and then am I gonna make it? Am I gonna make it? Am I gonna be the one that can't make it through med school? You're talking about your parents. All of a sudden you're the eye of your parents.
Yeah.
Your parents are so proud of you. Oh, my child goes to med school, and then now you're there. Like, are you gonna be the one? Are you gonna make it? Are you gonna make it through? Because if I think remember, based on what we've discussed, everybody who gets into med school has got the academic capability. So that's not why people, there's other factors that can stop people from making it through med school. So that was probably the only thing that I didn't struggle with it, but it was always in the back of my mind, like, I need to get through. But yeah, other than that, though, I had a good time. Med school, good times. So yeah.
And what's the process in terms of picking as well which area that you want to specialise in?
Exactly. So good question. So when you finish med school and you become a junior doctor,
so this is after 7 years.
After 6 or 7 years.
6 or 7 years.
Even 5 years. You can 5, 6, 7 years, depending on what program you're on. Go to med school. Whether you do an intercalated BSc, you don't do an intercalated BSc. So you finish med school. You have final year. Now, when you're in final year, you do an exam called the situation judgment test. This is not going to affect whether you pass med school or not. This is a completely different exam. Okay? They use this exam plus how you've performed in med school. So in med school, you get ranked at the end of every year. Top quarter, second quarter, third quarter, blah, blah, blah. If you've got any publications, blah, blah, blah. So you get points, and then you do this test. And then they add all the points together. And then they release all the jobs from Scotland to Northern Ireland, the whole of the UK. Then you have to rank where you want to go. So obviously most people want to rank London, whatever. So they basically give priority to the people who score higher. Yeah. So I applied. London was my first choice. I didn't get London. I got East Anglia, which was Bedford. It's not too far, like an hour and a half, 2 hours from London. So that's where I got. I was in Bedford for 1 year. I actually then resigned from that job, from that training post, and reapplied because a new role came up. Somebody who was meant to go into Basildon, which is in Essex, they didn't turn up or they didn't want to go, so they re-advertised that job. So I applied for it. So then in the second year I was able to kind of move back home. So that's how it works. It's so when you get F1 and F2, everybody has to do a surgical rotation. So you're going to be in a surgical ward. It can be colorectal, it can be upper GI, orthopedics, and then you have to do a medical rotation. When we say medicine, we mean gastroenterology, we mean cardiology. We've got things that we call medical specialties, things that we call surgical. So you have to rotate through at least one of each.
Okay.
I did surgery, medicine. I did care of the elderly. I did A&E twice in the 2 years, so F1 and F2 were 2 years. So that process is meant to kind of expose you to the different specialities so that you can then have an idea of what you want to do. So that's why it's compulsory that you have to kind of rotate through those specialities. So yeah, for me, I rotated through it and I learned the things that I didn't like, which was I didn't like being on the ward. You know, if you, on a ward, I don't know if anyone's ever been in hospital, you go in, you do a ward round, you go to every single patient, you know, there's a lot of writing, you know, reviewing stuff. Then the consultant, whoever the most senior clinician will tell you what each patient needs. And then as a junior doctor, you go around and you basically do it. So some people like that. And then surgery was better, a little bit better, because it's a lot more quicker. You get to also spend time in theatre to actually see people operating. You get an opportunity as well to do some operations. I did A&E, which I really like. I really, really like A&E. I mean, if I'm going for what I was most passionate about and what I enjoyed the most, it would be A&E.
Okay.
It's really, really good. Action, fast. You know, people come, they go. On the ward is a bit different. They come, they're unwell. People don't realize a lot of medicine is patient. We're not. What do I say? We're not really doing anything. Like you're not really doing anything. The healing that somebody goes through is a natural physiological response. If I cut you, your body wants to heal itself. Now the issue is, are you going to lose too much blood before your body heals itself? And that's where we come in. So we can replace your blood. We can put pressure where it's bleeding and allows your body to heal itself. And the same thing, when somebody gets admitted to hospital, let's say an elderly person comes to hospital, let's say they've got like a really bad pneumonia, their immune system is ultimately what's going to do the work. Sometimes we need to support that by giving them antibiotics. While they've got that infection, they may not be able to maintain their blood pressure, which is what will lead to them dying. So what do? We help them maintain their blood pressure. We give them antibiotics, but the actual healing process is done by them. So that's what we do. We're supporting the physiology to allow their body to heal themselves. So it's a very, very slow process. That's the point I'm trying to get across.
Yeah.
So, you know, you have a patient, they're there on Monday, they get a bit better by Tuesday. On Wednesday, they get a bit better. Thursday, a little bit better. Friday, we're going to try getting them to walk. So, you know, you need to kind of have that mindset, you know, patient person to kind of, you know, so even within medicine, there's different personalities. And for me, I think I wanted fast action. Come in.
So you wanted that pressure then?
At that time, because you're young. I'm young, innit?
Yeah.
And you think you can be, yeah. But I mean, the thing is, so ultimately though, you finish off one lecture and you have to make your decision, isn't it? Okay, what am I going to do? And you're going to ask me, Des, why are you not doing A&E? Because A&E, they need A&E.
Yeah.
Cool. So for me, I'd learned from when we applied for medicine, which was, I mean, I only say I regret applying for medicine, but I learned that when I applied for medicine, I made the decision as an 18-year-old. At the age of 18, this is what I like. This is what I want to do. So when I was trying to pick my specialty, it was like, okay, there's your 25. Well, how old I was 27 then actually, when I okay, and I just got married. I was thinking, okay, you're going to have kids. Okay. If you do A&E, you're going to have to be in the A&E department, God willing, for the next 40 years. It's all good in your 30s and your 40s going into A&E and this action that I'm talking about, right? Doing it and, you know, loving it, the adrenaline. But when you're 50, are you going to do that? When you're 60, are you going to want to do that? So I tried to make a decision as to something that I'd be able to sustain. So that's why I picked radiology. Because radiology is what you make it. Most of the time with radiology, so I work at home, I can work from home because like I mentioned, most of what I do is like reporting. Yeah. I don't actually need to be in, so I can work at home, so it's a lot more flexible. And it's something that I think I'll be able to sustain for a longer period of time. And it's something that works with family life as well, because I can kind of work around picking up the kids, you know, and kind of getting work-life balance compared to other specialties. Yeah.
That's a lot. At 18, what was it that you'd seen about A&E that
So
made
in A&E, no,
yeah,
so
how
A&E was doing F1 and F2.
okay.
So that was
Yeah, but what, like, because you said you'd made that decision that you wasn't going to go into A&E, isn't it, at 18?
No, not 18.
Not at 18.
That was after finishing med school.
Oh, okay.
Yeah, so after finishing med school, like I said, then you do as a junior doctor, you kind of rotate through everything. So that's when I rotated through A&E.
Oh, so it was your exposure.
Yeah. I liked it.
Yeah.
I liked it.
But you looked ahead, basically.
Yeah, basically. Because the thing, ironically, there's no rotation in radiology.
Really?
Yeah, there's none.
Is that the case now?
Yeah, it's the case now. Yeah, there's no rotation. So what you do for radiology is you do a taste a week. So while you're working, they'll allow you to go and work in the radiology department for a week. And that's the only kind of exposure you'll get. Yeah, so there's no rotation. There's certain specialties that there's no real rotation, like histopathology. You know, the people who look under the microscope. You know, if you biopsy something, somebody looks under the microscope to tell you, oh yeah, this is a cancer, this is not a cancer. There's no real rotations in that as well. So there's a few little niche specialities where you don't really rotate through. So yeah.
Okay. What is most challenging about your role as a radiologist?
I think the most challenging part about radiology is that ultimately the buck falls with you. So if you report a scan and you miss something or you get it wrong, it's you. In all other aspects of medicine, I feel like there's a lot of, you see your GP when you're unwell, then your GP refers you to the cardiologist. Then the cardiologist does a few scans, gets the respiratory doctor to look at you. Then they do a few more scans, they see something, they take a biopsy. Then it goes to the histopath. You see so many people, and normally if there's a mistake or something happens, there's normally like an issue with the system. You're never really going to be able to say it's this person, oh, the cardiologist should have got it, or the respiratory, But in radiology, it's you. The scan has happened, you reported it, you said it's normal, it's not normal, it's you. So that's the most challenging aspect, that literally and nowadays, the way medicine is very, very much all centered on radiology, which was one of the other reasons why I picked it. At the time when I went into radiology, it was becoming, when I was an F1, so 25, I was in Bedford. When we used to do nights, for example, if a patient had a head injury, we would not do a CT scan. We would do something called neuro observation. So every hour we'd go look at the patient, make sure they're okay, and that would be enough. Nowadays, immediate CT head. Yeah, the amount of imaging that is done has gone up by 50% for the last 7 years in a row. So every year, up 50%, up 50%, up 50%, up 50%. So it's a fast growing specialty. They're doing a lot more screening, like for like preventative medicine. So it's really, really expanding. So that was one of the reasons. But as a result of that too, is also a lot of, once you basically have a normal scan, it's assumed that you're okay. So that means that there is a lot of pressure with the radiologist to get the right diagnosis. Yeah.
So how do you mentally prepare yourself, basically, knowing that?
Yeah, so I mentioned that the med school was challenging.
Yeah.
Training to be a radiologist is another story. Yeah, and it's the same with every other specialty. So when you're in med school, you're a full-time student, aren't you? Like I said, I had a good time, because you go in, you have fun with your friends, you study, you go to lectures, blah blah blah. It's similar to other lectures, other university courses. But then you go into training, subspecialty training. You still have exams. So the toughest exams that I've done were radiology exams. Yeah, so after the F1 and F2, radiology training is another 5 years. Yeah, so you start off as an SD1, SD2, you have to do exams, you have to pass. When you pass those exams, you get to SD3. Pass those exams, you get to SD4, and then you've got your final exams. If you get your final exams and you've satisfied everything else, there's other stuff that you have to do, then they will allow you to become a consultant. I had never failed an exam until I started radiology.
Really?
Yeah, I failed I passed the part 1, the first part of the exam, but then the 2A says part 1, 2A, 2B. The 2A, I had to redo that. So I failed that the first time. Had to do that they don't tell you that we have to pay for these exams ourselves. Each exam costs £500. So you fail that, you pay again and you take that yourself. And then the final exams as well, I failed that and I had to do that again past the second time. And there are some people who take 4, 5, 6 times.
Wow,
yeah, to basically get through the exam. Yeah, so I mean, I think essentially the point I'm trying to get across is the exams during specialty training, probably not just for radiology, for any specialty, that it's quite tough. And I think the reason why it's tough is because you're having to balance that with working, and by then, you know, you're 26, 27, 28, you might be married, you might have kids, so it just makes it a lot more difficult. Yeah, I would say that's been the most challenging aspect about radiology so far. It was getting through the exams and getting through radiology training. Yeah.
You mentioned about the amount of imaging required increasing each year.
Yeah.
What are the volumes like that you have to deal with?
So as a trainee, a lot more than now, thank God. But so as a trainee, I worked in St Mary's in Paddington, which is a trauma centre. So you'd be back. Yeah, okay. I was a senior trainee then, so like SC4, so 4th year of training. So you'd be there from an 8 o'clock shift at night to an 8 o'clock shift in the morning. You know, and you know you'd go through like 40 cases. You know, CT abdomen and pelvis, CT heads, MRIs, etc. Which is quite a lot in 12 hours. It's literally like you're probably working constantly throughout that shift. Right now, there's a lot of pressure because there's been a lot of investment in getting more scanners. So there's a lot more CT scans, there's a lot more MRIs. But the issue is there's not enough manpower or woman power to essentially report the scans. So there is a lot of extra work if you want to do it, but there's also a lot of pressure because clearly there's going to be a lot of people who've had scans which have serious findings that are waiting to be reported. I'd say, is it the benefit? You can only report one scan at a time, if that makes sense in radiology. So the pressure that we get is a lot more external. It's not like working in A&E where literally there's 50 people waiting to be seen in front of your eyes. You know, you have to try and get through them. With this, we don't see the patients, we just have the cases and we try and work through them as fast as we can. So I think from that perspective, it's probably one aspect of medicine where you're shielded from the pressure that the patients are giving you because you're not directly facing it yourself. Because remember, for radiologists, we don't request the scans. So if you're like a GP or another doctor, you will request the scans. You see the patient. So when the scan has not been reported and it's not happened yet, they're coming to you. Vanessa, what's happening? Where's that scan? They don't actually directly come to us, so we're kind of shielded from it. We kind of face the pressure in terms of like from management and from other departments, kind of chasing reports. And I would say that so there's definitely a huge demand in trying to get through the work nowadays because we are scattered a lot more.
Do you have targets, and also how do you balance quality and speed?
Yeah, so I think quality and speed come from, so like I mentioned to you, within radiology you have your own subspecialty. So radiology, when you do initial training, is top to bottom once again. You do neuroradiology, there is chest radiology, there's GI radiology, there's something called nuclear medicine, like I said, which is what I do, so whereas radiology is just, putting you through like a CT scan, MRI for example, with my speciality, there's like an additional layer where we inject the patients with it's like a radioactive tracer that gives us physiological information as well to kind of simplify it. So because they try and encourage us to kind of have one field that we're kind of focusing on, just like anything, if you work on one thing constantly, you become really, really quick, really safe, really efficient. So that's how we try and ensure quality. You try and pick one aspect that you enjoy, that you like, and then that way you can be quick and you can be safe. That's how we try and ensure speed and kind of quality are maintained. But then other than that too, like I mentioned to you, I've got like a managerial role within my job, which is something called governance. And governance within healthcare is not just radiology specific, it's within every specialty. It's about maintaining and ensuring quality. So the way in which we do that is we audit ourselves. So a sample of my work is looked at, is reviewed to make sure that I'm not making any misses. If mistakes are made, we investigate them thoroughly. That's fed back to the rest of the department. If there's like a common theme, things that are being missed, things that we're not doing. We regularly carry out audits in the department. So like I mentioned, we reviewed recently something called our KPI, which is we have key performance indicators we do. So for example, we have like 2-week wait. It's actually now become a 1-week turnaround. If you think somebody's got a cancer, they need to have their imaging. The imaging needs to be reported. They need to have their biopsy and all the results back within 1 week. So these are key performance indicators. Now, along that 7-day working, there's going to be issues with scanning the patient, issues with reporting. So we are constantly reviewing that. If there's an issue with reporting, then normally we go to the hospital and say we need more money from more radiologists. If there's an issue with scanning, and that's one of the things that they found nationally, that there's an issue with scanning. So there's been, like I said, there's been a lot of investment. So we are constantly, and this is within all aspects of healthcare, it's part of medicine. So in med school we do a lot of statistics, and now I understand why. It's because a lot of medicine is also reviewing pathways, processes, which these are, like I said, I didn't know this part when I wanted to do. I just thought, oh yeah, you just go, you see patients and you go home. It doesn't work like that. There's actually a lot of managing as well. So yeah, there's a lot of things that we have to do to kind of maintain good quality, which we do, yeah.
Are there particular technological advancements that has helped 100%. With your field?
100%. So when it comes to technology, radiology is the center when it comes to medicine. So for example, like I mentioned to you, when I first started medicine, we were hardly doing that many CTs, but now CTs basically rolled out. Things like MRI, which I know you've heard of, but MRI is still relatively quite a new thing. 30 years ago, there wasn't MRI. Like I said, within nuclear medicine, I do something called PET-CT reporting. You can Google it, PET-CT reporting. So it's positron emission tomography. And it's basically, we inject people with a tracer, and essentially, just to cut a long story short, that tracer gets picked up by cancers. So if you basically inject it, maybe we can put a link in so that people can have a look at what it looks like.
Yeah.
When you inject the tracer and then you do the CT scan, it lights up. So it just makes the cancer a lot more easier to see. Yeah. So there's definitely a lot of, so that's one. And then so with that same kind of principle, we can give other tracers. For example, tracers that will pick up renal cancer, tracers that will pick up prostate cancer. So there's one called PSMA, which we use for prostate cancer now, which is excellent because it helped before. So to kind of explain the problem that it's helped us solve, sometimes we do a CT scan and imagine we see like something really, really small, like it's tiny, 5 millimeters. We'd be like, oh, there's something 5 millimeters. We don't know what it is. It may be something, it may be nothing. And then, it's just, we come back next year and all of a sudden it's 2 or 3 centimeters and it's too late, right? Because remember, every cancer starts off as something small. As humans, I think our brains are, if it's big, it's bad. If it's small, it means it's good. But everything that's bad starts as something small. So some of these technologies allow us to see these cancers when they're really, really tiny. And without that information, we would have otherwise ignored it and thought that it was something completely normal. Yeah. And also, the reason why radiology is also, like I said, central to kind of the advancements is a lot of the medicines. So for example, which is also important, the treatment for cancers, all these other treatments. Yeah. How do you know it's working? How do you know? I mean, you could just give it to everyone and then see who lives and who doesn't live. Or you need some way of measuring, right, whether things are responding. So once again, that's where radiology comes in. You need radiology to kind of measure whether the intervention we're having in patients is actually making a difference or not. Especially this is predominantly from a cancer point of view.
Okay. Yeah. What role do you think radiology has in the future of healthcare? I think
it's so utilizing artificial intelligence. I think radiology, there's a lot of stuff that radiology is going to be able to do. I mean, it's possible to scan you and using the information that we see on the CT scan to be able to make the diagnosis without taking a blood test, without biopsying you, all of that. Just from being able to properly break down what we're actually seeing anatomically, and then utilizing things like nuclear medicine. And then also in preventative medicine. So one of the reasons why, because some people always say to me, for example, oh, why don't we just go on a CT scanner every 3 months or every 4 months? Why not? Because then you can, just kind of you're constantly looking for bad things, if you see bad things. So one of the issues with radiology, and one of the reasons why you have radiologists, is because the way in which we acquire some radiological imaging, so mainly X-rays and CT scans, is using something called ionizing radiation. I don't know if you remember this from chemistry. So ionizing radiation is is radiation that can cause cancer. When there's a nuclear bomb, I've used the term nuclear medicine. If I drop a nuclear bomb, what happens? Everybody, it gets irradiated and people develop cancers. That's what happens. So, I can't scan you all the time. If I keep putting you in a CT scanner, I will eventually give you cancer. This is one of the reasons why when there's a bit of reluctance, especially when you're young, when you go to the hospital for them to do a scan on you. Everyone wants a scan when you're unwell. I've got a headache, I want a scan. My tummy hurts, I want a scan. That's the main limiting factor. The main limiting factor is if you're scanning young patients, these cancers, they normally develop like 30, 40 years afterwards. So normally if somebody comes in and they're 50 or 60, we'll put them in a scanner because they'll be dead before they develop a cancer. Whereas as a young person, if you think about, when you're older, you're probably going to need more imaging. As a young person, we have to be considerate about how much radiation you're being exposed to. So one of the technological advancements that's happening is a lot of the CT scanners now, they've managed to reduce the radiation. So that will allow us to kind of scan more people. And then also, there's just a lot of science that I need to go into to make it make sense. But something like CT scan is good because it can kind of do the whole body. But it's ionizing radiation, right? So that's bad. But something like an MRI is good because it's not ionizing radiation. So you can technically scan everywhere, but then you can't see things like in the lungs. MRI works by, it's like a magnet, but it looks at the way in which hydrogen atoms are aligned. Anyway, basically it wouldn't be useful for all forms of imaging, but new technologies are arising that would allow us to do MRI. We call it whole body MRI. And for whole body MRI, for example, you could get in there every week if you wanted to. In reality, you could really get in there every week. One of the limitations for MRI over CT is MRI takes a longer time. So a CT scanner, you go in, you come out, scan done. An MRI, you lie in, and you're there for half an hour. While that's in my hospital, we've only got one MRI machine. So if you imagine, if it's taking half an hour to scan every patient, and that's at least, how many patients can we scan per day? Let's say in a 12-hour day, you can only scan 24 people. It means that it's not really practical to have MRI as something for screening. But now the technology is allowing for the MRIs to happen a lot quicker. And with MRIs to do with, basically there's good things coming out there that will allow us to image people with less radiation and, which will allow us to kind of pick up things a lot earlier than we're doing now.
What has contributed to your success, would you say?
Well, success. Assuming I am successful. Okay, I'll say I'm successful in terms of I set out to want to do something, and so far, by God's grace, I'm making progress, and I've been able to kind of overcome most of the objectives that I've been able to set. What's contributed to that? Prayer, and being determined, not giving up. I think it's the same. Ultimately, I think I've listened to a lot of the people who've come on the show, and I think to be successful in any field is the same. It's not rocket science. You're gonna hear the same thing over and over and over again. So I'd say you have to work hard. You have to be determined. You have to not take no for an answer. You need to kind of keep pushing yourself, and don't allow yourself to be discouraged. I don't think you can ever become successful in anything you do without facing a period of discouragement. If people want practical, classic advice, I'd say to be successful in medicine, for example, then you have to know that academia is important. You know, you have to be able to get top grades. How do you get top grades? People talk about natural ability. Like I said, I don't believe in natural ability. What I always told myself was outwork everyone. You know, I used to just say that to myself, outwork everyone. And I was told back then, somebody said this to me, and it stuck with me. They said, I think that in those days, when I say those days, can you imagine? I don't like those days. I'm not that old, everyone. I'm not that old. But they said, like, only 20, like, it was either 15 or 20% of people would get A's and A stars. That's how many people got A's and A stars, and that's what you needed. So I used to tell myself, okay, that means I need to be working harder than 85% of people. So and I thought to myself, well, if most people are doing an hour or 2 hours of studying, I'm doing 3 hours of studying. Yeah, so that was practically for me. And this, I'm speaking as somebody who I don't think I've got what you'd call natural, you know, some people can literally just read it, done.
Yeah.
Got it all. I don't think I'm one of those people. I have to read things over and over and over again, and it has to make sense. Yeah. If you're somebody where you read and it has to make sense, you can't just read it and it says that I'm gonna go and write it. I need to understand it. Then you just have to accept that about yourself and don't let that get you down. And then I think that's it. And then I think nowadays, networking, talk to people. For something like medicine, find out you really want to do it. I'm not going to sit here and tell you that I have I'm 100% happy going into medicine. Yeah. Because there's a lot of sacrifices. Like the best times of my life, I'd say, 18 to 25, I was, I wasn't doing certain things that I wanted to do. It's paid off to some degree. But there's still, some people don't want that. And there's so many other things that you can be successful in, and like we discussed, you shouldn't be pursuing medicine because somebody's making you do it or there's pressure from like family or whatever. It has to be something that you want to do. We need doctors. We can't have everybody being influencers and doing shows like this. We need people. we need people in the hospitals too. So I will also encourage anyone who's interested that is it rewarding? 100% it's rewarding. But you need to kind of know what you're getting yourself into. Because I think when I look at some of my friends, for example, that started medicine and didn't finish, or the ones that finished and then didn't pursue medicine, the key recurring theme is, I think, expectation. Okay. They went into something with one expectation, and when they got there, they saw something else. Yeah. And then they were like, okay, no, this is not for me. So the key is knowing exactly what you're getting into, and knowing exactly what you're getting into is knowing what the first year is like, what the second year is like, what the third year is like. I was said we went to live in Chichester for like when we were like in year 3 or year 4 of med school. Then we lived in Eltham, and then we went to like just kind of rotate. Is that because some people get homesick, some people want to kind of be at home, and for some people they like medicine, but the fact that you have to go to all these places is too much for them. So does your personality kind of align with that? Those are the things that you need to kind of work out. Yeah. Great.
The part that I know everyone wants to know about, which is the pay.
Oh, the pay.
Yeah. What are like the ranges for like a consultant?
Okay. Yeah, I mean, this information is actually not a secret, by the way. If you go on like NHS jobs and look at the pay for a consultant, it's there. So I'm just going to kind of disclose the information that's there. So I mean, I think one of the things to take in mind is it depends like how many weekends you work, how many nights you work. You can imagine, for example, if you're like a surgeon and it's expected that you're going to do, you're going to be working every other weekend, you're on nights once a week, etc. Obviously, that person's going to get paid a lot more than somebody doing a speciality. I mentioned things like histopathology. If you're like a consultant in histopathology, you're just kind of sitting on it's a 9 to 5 job. Basically, radiology is a combination. We do weekends. Depending on we rarely do nights nowadays, but it depends where you work. So I'd say the range on average, it probably varies. So between 80, when you first start as a consultant, between 80,000 and maybe 95,000 starting first year as a consultant. And that depends on kind of how many weekends and stuff you do. And then it can go up as the years go on, but that depends on, what I mentioned to you, like if you then take on like managerial roles, if you they call it like clinical excellence awards. So some of these doctors then start doing research and developing new technologies. Then with that you get like you can kind of get payments go up as well. So that's probably the starting, and then it rises. They're currently kind of talking about renegotiating a contract for the consultants. But all that information is on the NHS website anyway.
So being a family man, how do you balance like work and family life?
I think now is a lot easier. As a consultant, is a lot easier because this is actually the first time since 2006 when I started med school that I'm in one place. Where I'm working, that's where I work in Diabetes, that's not hospital.
Okay.
That's it. Other than that, prior to that, I was in, when I first started radiology training in 2016, that's when my kids were born.
Yeah.
My kids were born on the same day I started radiology training. I went to Margate, then when I finished in Margate, I was in Canterbury, then I was in Maidstone, then I was in Tunbridge Wells, then I was in Kings, then I went to Imperial, just kind of all over. All over the place, and which is quite difficult. But now I say I'm a lot more settled because at least I know I'm here.
Yeah.
You can and then as a consultant too, you can you know how it is.
Yeah.
The higher up you go, you can get the juniors to do most of the work. It's like that in every field. They make you do all these exams, and then when you finish, like when you become more senior, then you're just. So my role is more supervising. I do my work, but then a lot of my work is also supervising. So some of my junior colleagues will report scans, and then I will review the scans, etc. Or so once again, that allows you to have a bit more flexibility. And for me, within my specialty, like I said, radiology, I get to work from home, which is helpful. I can drop the kids to school, come back, do some work, take a break, go and pick them up, and kind of work around that. So I think radiology is one of the few fields within medicine that allows you that flexibility. There are some specialties where it's very, very difficult to balance work with family life, just because of how essential your presence in the hospital is. Does that make sense? Yeah.
Sure. Is there any specific resources that you'd shout out for people to use?
I would say you can. So one of the things is, like I mentioned at the beginning, if you're looking to go into medicine, nowadays the med schools, are really different in terms of what they're looking for. Some people want chemistry, some people don't. Some people want biology, some people want chemistry and biology. Some people want maths. Some people want chemistry and biology, but then they want you to do like an English or a history. So have a look at UCAS website. Make sure you know specifically which med schools you're applying for. And then also looking at things like the UK CAT and the aptitude test. Book yourself in a course early to kind of get prepared if you're looking to apply. Try and arrange work experience. And I would say when you arrange work experience, really go into any work experience with an open mind. Don't go in with a mindset of, I want to do medicine. So kind of go into, let me see what medicine is like. I think understanding what the universities want on the UCAS is something that you can basically do.
Great, thank you. Do you have any final words? Anything else that you want to share that I've left out? Side hustles.
Side hustles. Yeah, I've got a few side hustles, but we can come back and have a conversation about that. But I would say that try and keep your if you do follow medicine, I think medicine it tries to trap you. That's what I would say about medicine. It's a negative about medicine. It tries to, because you are so, it takes up so much of your essence. Let me put it that way, because we've not even spoken about the fact, you've gone to med school, you've done all this reading, you've done radiology training, you've done all this reading. Now you're a consultant. Like, how do you maintain your skills? Maintaining your skills, it takes up so much time. Some of the senior consultants, when they trained, there was no MRI. So when they did radiology training, when they went in med school, there was no MRI. So somehow they've had to then kind of learn and on the job You know, so it's with medicine. That's one thing. You know, it's if you're very interested in science, and you know, then that's fine. But if you've got other interests, it's something that you're gonna have to kind of work hard and fight for to kind of maintain. And I would advise that to kind of be a well-rounded person as much as you know. And I think you can probably take this into whatever any field, whether it's law, whatever you go into, try and still understand what's going on. You know, try and see what other you know interests. Try to explore other interests so that you're kind of like a well-rounded person and you don't kind of put yourself in one hole. But yeah, other than that, yeah, you know, I believe that anyone can achieve whatever they put their mind to. I think everyone's got so much potential, and most of the limitations normally are self-generated. So try and just develop that mindset, you know, and believe that, you know, whatever you put your mind to, that, you know, you can definitely achieve it. So yeah, that's it.
Thank you so much. It's been really eye-opening.
You're welcome.
I'm sure you've picked up a lot from that interview, and there's so much to learn. And what I've really taken from it is that medicine is definitely not for the faint-hearted. You have to ensure that if it is a career path that you're looking to go into, you really need to talk to others within the field, do your research, try and gain some experience and an understanding of exactly what you're getting yourself into before you take that step. And then it requires a lot of hard work and dedication to continue. It's really interesting to see Desmond's journey throughout to now being a consultant as a radiologist, and just seeing what that process looks like. So if you've enjoyed, make sure that you continue to stay tuned, share the link so that people can get the information, like and comment.